All right, welcome everyone. This is Dr. Clark from the Center for Weight Loss Success. Today in Losing Weight USA, I'm going to talk a little bit about nutritional ketosis and some of the potential other benefits. There is a benefit for weight loss, and they're kind of keeping your insulin levels down, but there's also potential other benefits from that from a other overall health standpoint. And so we'll go into some of those different aspects of this. All right, welcome to News and Weight USA, real-time answers to your weight loss questions, some of the latest updates, as well as a little bit of expert advice. Should be receiving the health tips and recipes via the membership portal, and I encourage you to get into the membership portal. We keep adding more and more things in there. All these live webinars are recorded and uploaded into there, but all the behavior modification classes, lots of exercise things, menu, recipe ideas. Each webinar here is going to last about 30 minutes or so. If you have questions, type them into the chat box as we go along. We'll answer them at the end. If you think of things once we're already done, just give us the Alta Center for Weight Loss Success. The email is success@cfwls.com. Phone number 757-873-1880. Very good. That'll work. All right, so first thing we're going to hit, again, we're talking about nutritional ketosis, and are there some other potential health benefits? Certainly, nutritional ketosis does have some benefits for weight loss, but we're going to talk about other things that potentially it can help as well. So first we'll talk about just what is it? What's nutritional ketosis? And we'll talk a little bit about adaptation, because it takes time for these things to actually occur. You need to adapt to them. We'll talk about kind of working through that. And then we'll talk about athletic performance, cardiac function, treatment for possible epilepsy or seizures. Is there any thought about cancer, treating it, as well as prevention? And what about aging? And then kind of putting this all together is kind of, how does this impact our lives, so to speak? All right, so nutritional ketosis then. Basically, it means that your body is using the breakdown of fat or ketones for its energy source. Your body can only utilize two sources of for energy production. Okay, and glucose is the major one. It's the one your body uses most easily, or sugar. Okay, glucose or sugar. Now, sugar is all glucose comes from carbohydrates. Okay? Now, the other thing they can use is ketones. Ketones come from the breakdown of fat. And it is a very good energy source. And if you actually look at glucose versus ketones, ketones are actually a more efficient energy source, meaning that it takes less to utilize the ketone. It takes your body less work to utilize the ketones as an energy source as opposed to glucose as an energy source. So just from an overall machine efficiency, ketones potentially is the better, more efficient energy production there. All right, so first hit on glucose. Glucose comes from carbohydrates. Okay, anything that is a carbohydrate will break down to glucose, and then your body uses it as an energy source. Now, your body will preferentially utilize glucose for fuel if it is given a choice. Meaning that if you're eating both, plenty of carbohydrates, plenty of fat, it'll choose to use the glucose as its preferential fuel. Okay? Now, people often somewhat think that we have to take in glucose. If not, we don't get enough energy. But your body actually has no requirement for an intake of glucose. And the reason is because your body can actually make glucose, and it can make it from the breakdown of either protein or fat. So as long as we get adequate protein, and if you get some calories from fat, your body can make glucose. So it isn't that we have to take in a certain amount of glucose. And your body actually is very good at keeping glucose levels fairly even. That's what your liver does. Your liver will make glucose. And subsequently, then you don't have to take in glucose. That's kind of a misconception that, you have to take in a certain amount. Well, no, you actually don't, because your body can make it. Okay, so again, your body will preferentially use glucose if we give it plenty of glucose, meaning more carbohydrate. Ketones, again, comes from the breakdown of fat. In ketosis, when we say the word ketosis, all it refers to really is having ketones in your bloodstream. And we have ketones in our bloodstream all the time, all the time. So even if, no matter what you're eating, you still have some ketones in your bloodstream. So when people talk about, gee, ketosis is a bad thing or something like that, ketosis is a normal thing. So ketosis just refers that we have some ketones in our bloodstream. So normally these ketones are a very low level, okay? And this is not to be confused with ketoacidosis. Ketoacidosis occurs when a diabetic, their blood sugars get way, 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 way high, and subsequently then they go into what's referred to as ketoacidosis, and their pH of the blood falls way down. We can't live with a very low pH. And so it's truly a life-threatening problem. That's diabetic ketoacidosis. That is not the same thing as just saying ketosis. Okay. Now, during weight loss, okay, we would actually like to utilize fat. So again, ketones comes from a breakdown of fat, and it can be used as an energy source. So during weight loss, ideally, hey, we want to break down fat. We want to break down fat. We use that fat as an energy source as opposed to using carbohydrate as the energy source. As if we're using ketones, the breakdown of fat, we're breaking down more fat. If we're breaking down more fat, typically we're losing more weight. So during weight loss, you would like to be using fat as the preferential energy source. Okay, now you can do that if you just cut calories way, way down. Well, then, yes, your body will use the fat as an energy source. Okay, but if you actually not cut down quite so much, but utilize very, very low carbohydrate, and subsequently then your body will also use fat as the energy source. Now, in order to do this, though, the unsaid thing here is that, well, you have to take away the carbohydrate, which means that, okay, you need to be in a very low carbohydrate diet for this to work effectively and efficiently. And that's nutritional ketosis. Again, is your body is going to then, since we take the carbohydrate away, therefore the glucose will stay very stable because your body can make it, but it's going to utilize then ketones as its preferred energy source. And again, ketones are actually a more efficient energy utilization than using glucose. All right, so now adaptation, I mentioned this earlier, kind of adaptation can take some time and it can actually be difficult. And when I say adaptation, what I mean is that if your body is used to using glucose as its energy source, and now we take the glucose away, well, your body has to adapt to utilize ketones more efficiently. And basically what you think about it this way is that in order to take glucose or ketones and utilize it as energy source, you have to have all the appropriate enzyme systems to take that molecule, break it down, and then eventually break it down to ATP, which is the money of energy. Okay? Well, if we typically utilize glucose as our energy source, well, your body does not have the enzyme system revved up in order to then just switch automatically. It's not like just flipping a switch, okay, I'm done using glucose, now I'm going to use ketones. Is your body has to adjust to it, it has to adapt to that, and subsequently then your body will utilize, once it again gets that enzyme system revved up, okay, it'll then utilize the ketones much more efficiently. Now, just as a kind of component of how much can your body store of either glucose or ketones, okay? Well, glucose is typically stored as glycogen, and your body can store small amounts. But even so, it can't store more than about a pound, literally, of glucose. About 100 grams in your liver. If you think about grams to pounds, okay, there's like 450 plus grams in a pound. So the 100 grams you can store in your liver, That's about it. About 400 grams in your muscle. So your muscle is actually the biggest storage organ for glucose. Okay, and then about 5 grams, or about a teaspoon, in your bloodstream. So the bloodstream really is an effective storage place then. Okay, but you can store a little in your liver, most of it in the muscle. Now, the muscle doesn't like to give it up, speak to the rest of the body. It wants to keep it so you can, get out of the way or run away from the saber-toothed tiger, or jump out of the way when the car is about ready to hit you or something. Okay? So that kind of quick release there. The muscle needs it there. So the muscle doesn't like to utilize and give it its stored glucose to the rest of the body. So in your body can store about a pound of glucose, sugar, and utilize that as an energy source. Well, as you think about, it's pretty much unlimited how much your body can store as fat. Again, literally, there are many people that may have 100 pounds of fat. Right? Just for someone, just as an example, a 200-pound person that has only 10% body fat, which is that they're cut. Well, 10% of 200, it means there's 20 pounds. So there's already 20 times enough more energy source in that person than they have as glucose. Okay? So even for someone that's very fit, okay, they have much more kind of ketones available, or fat available as an energy source. And so subsequently, it's pretty much unlimited. Okay? But again, you can't just flip the switch and say, no, I'm going to use ketone. I'm going to use fat as my energy source. You have to adapt to it. Okay? And adaptation takes time. So it takes time to rev up these enzyme systems. Athletes can actually do this in a relatively short period of time, about 3 weeks or so. The more overweight someone is, it tends to take longer to rev up that enzyme systems. So for a lot of our obese patients, okay, for an obese individual, it may take a good 4 to 6 weeks. Okay, what does that mean clinically? Is that during this revving up period of time, you may feel tired. I have no energy. And we see this in some of our surgical patients, in that first month and a half, they'll come and say, boy, I am just so tired. I can get up and do things, but I get tired really easily. I just want them kind of slowly, their energy level comes back. As opposed to, we have some individuals post-surgery, they come and say, I have so much energy, it's incredible. Okay, they can rev up that enzyme system fairly quickly. Other ones, it literally can take up really probably closer to 2 months to get that enzyme system revved up. And the problem is that if they're trying to avoid carbohydrates, but if they drift back, gee, I have carbohydrate, I have a little more energy, then they have to kind of start all over again. So it kind of makes it difficult, but the adaptation process is very real. And this was proven in one of these different webinars. I talked about kind of Arctic explorers. When they originally kind of traveled to the Arctic, they didn't carry food with them. They ate the same thing the Eskimos ate, which was basically in the winter. They basically ate, fat and protein from either walrus or caribou, and what they stored there. They didn't have any greens or anything like that in the middle of winter in the Arctic. And what the Arctic explorers, the European explorers, and they found out is that, boy, they had no energy for weeks on end, and they slowly adapted and they felt better than they ever did. And, that was, I don't know if we did that discussion, I don't know when, probably in a carbohydrate discussion, I imagine. All right, so now we're going to switch gears. Now, we talked about kind of what is nutritional ketosis and kind of how it does take time to adapt to it. But what are the potential other health benefits? And this is kind of the meat of the matter. So what about athletic performance? How many times do we hear that, oh, you got to get plenty of carbohydrates to perform your best athletically? Well, that's not true. Actually, there are many instances nowadays where a number of world-class athletes now live kind of very low carbohydrates, so they kind of live in ketosis. And what they found is that they actually perform better. All right, and there's some of these studies that were actually done back, 40 years ago. Okay, and 40 years ago, they started doing some of these studies on athletes and some on just regular individuals in the lab. Okay, in this first study, what they did, and this was again back in the 80s, they took the obese individuals, they put them on a ketogenic diet, which basically means a low carb diet. Okay? And they did this for 6 weeks. And what they found is that they actually had better muscular endurance than when they actually started. Okay? Now, to make up, you think, well, they lost weight, right? And that's why they have better muscular endurance, because they're actually lower weight. What they did to kind of compensate for that whatever weight they lost during those 6 weeks of being on a low carb diet, is that they had them wear a backpack or a weight vest. So it kept them at the same weight, so to speak, but they still had much better athletic performance. And what they found is once the muscles adapted, they performed better, and it actually is a more efficient energy source, but using fat as the energy source rather than glucose. So then they actually tried to do this not really a similar study, but a study using professional athletes. And what they used was pro bicyclists. So professional cyclists, they did this for 4 weeks on a ketogenic diet, that they actually had better endurance and they used less of their glycogen stores. Now, as I mentioned in the previous slide or a couple slides ago, is that we can only store a certain amount of glycogen in our muscles. And so subsequently, for an athletic performer, that they're working really hard, they're going to burn through some of this energy source unless they're constantly eating. So they are, in theory, are going to burn through this glycogen stores that they have in the muscle. And what they found is that actually on a ketogenic diet, is that they actually burn through less of their glycogen stores than if they were on a fairly high carbohydrate diet. So two big benefits. One, they had better endurance, and these are professionals. Okay? They had better endurance, and they actually used less of their glycogen stores, which really means they're less likely to bulk. If you're familiar with that term from athletic events, with someone who runs a marathon or very long distance, that at a certain level, if they're not keto adapted, is that potentially that their glycogen stores go way down, they basically bulk, meaning that the muscles can no longer give up any more of their glycogen stores. The brain's not getting enough energy then, so subsequently then they kind of pass out and they bulk. So what they found then is with these professional athletes that are keto adapted, is that they didn't bulk. Is because they could actually some could drive their blood sugars down into the high 20s, low 30s, which is very, very low blood sugar, and they had no symptoms. They had no symptoms at all. And they've used, again, less of their glycogen stores. So this also somewhat debunks the myth that you need sugar for energy. It's like, no, if you're keto adapted, what you need is the ketones for energy. And you have plenty of that. Even a very fit individual has plenty of fat in their storage. The next thing it kind of questions then is that thought of, do athletes, is it good to carb load prior to an event? Okay. So just to take that thought a little bit further then, that carb loading thought. So if you're kind of a weekend warrior and you're going to go do your 10K on Saturday and you think, gee, on Friday I'm going to have the lasagna or spaghetti, or I'm going to carb load. Okay. Does it actually help? The answer is no, it doesn't. Now, back to the professional athlete though. The professional athlete though, if they're not keto adapted, they're basically kind of most of their energy is coming from carbohydrate. They actually do get a benefit from carbohydrate loading. So for a professional athlete, actually they can benefit from carbohydrate loading. The weekend warrior, no. Why is that? Okay, well, the very well-trained athlete has somewhat of a flexible energy storage in their muscle system. They can actually overfill the tank, meaning that even if the muscles are full of glycogen, they can actually overfill them. It's kind of a rubberized tank, as opposed to most of us who are professional athletes. Then it's like, no, we got the standard tank. It's not, there's no flexibility to it. We can either fill it or we empty it. Okay, and we can only put so much in it. It's like you can't put more gasoline in your car until you've actually driven it around, and you can't just keep putting it in there. But for professional athletes, they have somewhat rubberized or stretchable tanks, so to speak. They can actually overfill. And so for professional athletes, there is some sense to carbohydrate loading. The rest of us, no, doesn't work. All right, well, what about heart function? So the heart's a muscle, right? Okay, we talked about kind of athletic performance, our muscles, okay? But the heart's a muscle, so could it actually help the heart? Okay, so kind of what about the other muscle, the heart? Okay, and that's obviously very important for life. So in animal studies, what they found is that cardiac work, as well as oxygen consumption, as well as cardiac efficiency, all improve utilizing a ketone infusion, meaning that they're providing ketones to the heart muscle. They've actually, in some of these studies, they've removed the heart, and they have ways they can actually keep it beating. And subsequently, then they found the heart actually worked more efficiently with ketones than it does with glucose. So not only does the heart function fine with ketones, but it actually functions more efficiently and utilizes less oxygen. Now, you think about that. Take that and, think about, okay, a heart attack victim. Heart attack victim is kind of blocked off one of the arteries, so the rest of the heart is not getting the oxygen that it needs. And it gets us through blood flow. So if blood flow has been cut off, the real issue is that the heart is no longer getting oxygen. That section of the muscle is going to die, which eventually leads to the body's death. Okay. So what if if you're keto adapted, or if you actually infuse ketones, kind of someone had a heart attack victim, and it's used, the muscle actually uses this more efficiently on less oxygen. It's like, well, this could potentially help with treating cardiac problems. Now, the qualifier on that is the individual with the, quote, heart problem has to be keto adapted. Again, you can't just flip the switch and say, okay, now your heart's going to give you ketones, it'll work better. It's like, no, you actually have to be keto adapt. You have to kind of live that way. And if you got a heart problem, subsequently, then you are more likely to survive because your heart is more efficient and it can utilize this. All right. So talk about muscles, athletic performance, talk about heart. Let's talk about something that's relatively rare, seizures, epilepsy. Okay, epilepsy is the the medical term for someone who has seizures. Okay, now seizures or epilepsy affects about 1% of the population, so it's not that common, but it certainly isn't uncommon. Okay, now the problem, they have lots of medications to help treat seizures. But one of the problems is that about 20 to 1/3, 20% to kind of 1/3, 33% of patients that have epilepsy don't respond well to medications. And it doesn't work. The medications don't work that well. Now, literally thousands of years ago, Hippocrates noted that fasting, we talk about fasting in some of these discussions, that fasting leads to a better seizure control. Well, he didn't know why it worked, but he just knew that it did work, is that basically kind of low energy intake and actually better seizure control. So in human studies then, what they did is they looked at some of the poorly controlled epileptics, people that had seizures, and they put them on a very calorie restricted ketogenic diet, so very low carbohydrate diet, but also very low calorie too. And what they found is that the ketones that within our bloodstream, the ketosis, actually would help treat and would completely get rid of seizures in about 16% of these people that were poorly controlled. Okay, and in greater than 90% of the people that were poorly controlled, there was a reduction of their seizures by about 1/3. And so they found, hey, this can actually help control seizures. We have very poorly controlled seizures. So if you know, or gee, if someone is very poorly controlled epileptic, and on a very low carbohydrate diet, is they're very likely to have better seizure control. So ketones tend to have an anticonvulsant and a neuroprotective property. So it can protect the neurons that mainly are in our brain, okay, throughout our body. All right, so what about another thing that's fairly common? Cancer. Now, what we know is that many common cancers are actually dependent on glucose as an energy source. If you think of a cancer as being abnormal cells that are in our body, that they had a mutation, genetic mutation that occurred, and now they have abnormal cells that are growing out of control. That's what a cancer is. So it's an abnormal, that's why different glandular tissue will have different types of cancers. Breast cancer has breast cells, pancreatic cancer has pancreatic cells. But they've somehow gone through a mutation that allows them to grow out of control. Okay, many of these cancers are actually dependent on glucose. In order for a tumor to grow within our body, it has to get an energy source from it. So it has to, and it steals the energy source from our tissue, from our bloodstream, basically. So many common cancers are dependent on glucose as an energy source. Part of this is because insulin, we talk about insulin, glucose, low carbohydrate all the time, but insulin's the hormone that helps control blood sugars, but insulin is a growing hormone. Okay, for most of us, it means, gee, insulin goes up, we grow fat, so to speak. But for someone who has a tumor of one kind or another, and if it's glucose dependent, insulin will stimulate the growth of that tumor as well. So insulin is a growing hormone. So the concept then is if we take glucose away, we lower the insulin levels significantly, and what happens? So in animal studies, we found that survival in mice, again, mice compared to humans, but mice would actually live twice as long with their tumor. So if they have ways they can give an animal, a mouse, or have it develop types of cancers. And subsequently then they would take these animals that develop types of cancers, do one a very ketogenic diet, very low carb diet, and one a not low carb diet. The survival of the keto adapted mice was twice as long. Now, in humans, not so easy to do these trials, but in very small trials of people that have treatment failures, meaning that they've tried everything they can, all the chemotherapies, all the treatments they can possibly do, and they're not responding well. Well, in some of these small trials, they had 50% of the people that did this had disease stabilization. Now, it didn't cure it, but it would slow the growth so much that they actually considered their disease was stable. So potentially then, could ketogenic diet be aiding cancer treatment? It can slow down the growth. If we slow down the growth, then potentially it's more treatable. Now, if you take that a couple steps further, then could it actually be utilized with cancer prevention? Meaning that even if you developed a cancer cell somewhere, if you lived in a keto-adapted state, basically a very low carbohydrate diet, which sounds a very low insulin diet, or very low insulin levels then, that potentially then you could actually prevent the growth of cancer cells. Kind of amazing things. There certainly are anecdotal evidence that this can work. Okay? But again, you kind of have to live this way. All right, so what about aging? Aging affects everyone. Now, eventually, there's only one way out of this world we live in, okay? So how can this actually prevent or slow down aging? See if it can actually increase survival in people that have disease process. Could it actually slow down aging? Now, it's thought that many of the problems associated with aging are related to the generation of oxygen-free radicals. And we talked about this in some of the phytonutrient discussions that we've had. So aging related to oxygen-free radicals that develop in our body. And that's where kind of antioxidants can come into play and hopefully prevent some of those problems. But oxygen-free radicals basically can cause damage to our cells. And that's part of why kind of we get wrinkles as we age in college and get over it. There are a lot of little things. We know this occurs. And the analogy of rust is real. And oxygen causes rust, like the wrought iron fence or whatever. Okay, if iron's out there and exposed to water, oxygen, it can rust. Okay, rust though, it won't happen without oxygen. So we need to kind of think of oxygen. Actually, we can't live without it. Okay, we've got to have oxygen in the air, but also then the oxygen potentially can cause some of these problems, and that's where the oxygen-free radicals. So could we slow that down? Is there a way? Each cell, when we talk about the life of each cell really we think about as cellular respiration. That's the utilization of oxygen to produce energy, or in all the metabolic equations that go on in the cell. Now, when I just say respiration, we typically think of breathing in and out. Okay, breathing in and out. But cellular respiration is kind of all those biochemical equations occurring in the cell. And the generation of energy is dependent on oxygen. Okay? And the breakdown products then of glucose or ketones. So use of ketones as an energy source, in theory, will decrease the production of oxygen-free radicals. Again, it's because it's a more efficient use of oxygen as opposed to glucose. It's often referred to in a measurement as the RQ, respiratory quotient. Okay. Fat has a respiratory quotient of 0.7, so ketones, as well as opposed to glucose, which is closer to 1. Okay. And subsequently then, utilization of ketones as an energy source is a more efficient machine. And subsequently, there's less oxygen used, which then potentially less oxygen-free radicals generated, and potentially could slow the aging process or cellular damage process. So what does all this mean? Okay, it's interesting stuff. That's true. The research is really still in its infancy, but I believe there is something to it. Okay, there is something to this. Certainly, we know that there's really no harm in significantly decreasing your carbohydrate intake. We know that you do not need to take in carbohydrate. It's not easy to do. I realize that, but there's certainly no harm that actually does. And potentially, there's tremendous gain in bodily function, disease prevention, disease treatment. So it's certainly something to consider in this whole thing, even kind of outside of weight loss, is that kind of living in a keto-adapted state, in a very low carbohydrate diet. You're getting your energy source mainly from fats, whether it be during weight loss, a breakdown of fat, or whether it's from fats that you may take in orally as part of your diet. So there's some really potential, interesting, and helpful things. It just needs more study on that. Fortunately, some of these studies typically would take a lifetime to really sort out, which isn't very practical from a study standpoint. All right, see a couple questions in there. Does a ketogenic diet help stroke patient recovery with the neuroprotective problem? Well, in theory, absolutely. Okay, and because again, it's just like I said, the heart can actually work more efficiently with ketones. Well, you can have a lower oxygen amount, meaning that if there's less oxygen getting to the tissue, whatever tissue we're talking about, we mentioned the heart, but the brain should be kind of a similar type of thing. The issue there is you have to live this. You have to actually, it's not like, well, I could, if I have a stroke, they'll infuse you then with ketones. That then, there'd be less likely to cause as much damage. Unfortunately, it won't work. It's like you have to actually, but the person who is keto adapted and had a stroke, okay, versus the person who's not keto adapted and has a stroke, very likely, again, this study, it's as far as I know, hasn't necessarily been done, but very likely would have a better chance of survival. And it's because it's fun, strokes are really different in every individual, and you don't know there's going to be a stroke till there's a stroke. So utilizing that knowledge and having someone that's keto adapted likely would do a little bit better, might have a better recovery. That's really theoretical, but it's same concept though, that potentially yes. So could it actually prevent then additional strokes? So strokes are basically blood not getting to your brain, however it happens, whether it be a bleed into your brain, I hit my head and I had a localized big bruise there, or bleed, or there was a vessel that burst, or there was a blockage of a vessel. Lots of different things can actually cause a stroke. It's just basically a stroke is a name that says the brain's not getting much blood. And if it doesn't get the blood, the tissue dies. Okay, it doesn't function well. So could it prevent additional strokes? Maybe. Again, that really hard to do that study, because you'd have to have a large group of people that lived keto adapted and subsequently compare them to a similar group that did not live keto adapted. So it'll be really difficult to prove that. All right, second thing, is there a body fat percentage that differentiates athletic from everyone else? Not really. I mean, I think that typically, and it's different for men and women. Okay, women tend to have more body fat than men too. It's just genetics, part of that whole thing. But very well-trained athletes may still have. I know some women that are incredibly in shape, and they have 20 to 25% body fat. Then there are some men that may be in single digits as far as body fat. So is there a differentiation? Like, no, there's some really well-trained athletes that they have a higher percentage of body fat, and it doesn't make it make them better or worse or anything like that. So I don't know that we can actually say there is a certain percentage that this body fat is athletic, this one's not athletic. I know in a lot of the body comp machines, the one we have in the office, it kind of lists it out. Here's an athletic body fat, but you could just be skinny. You should just have no very low body fat because someone's really skinny and they're not athletic at all. Okay? So that label there doesn't mean a whole lot. So anyway, it's kind of they put designations. Hope that answered the question. All right. So anyway, any further questions, just pick up the phone, send an email, stop by the store, still there. We're still looking for space. Yeah, don't hesitate to ask you to think of questions. I find this topic very interesting. I wish I could make myself truly live that way. But unfortunately, I'm very carbohydrate sensitive. I have to be very careful with that. But I can't claim that I live kind of keto adapted. I wish I could. When I try to do it, it's just easier said than done. It's easy to drift, just like everybody else. Keto, like taking ketones as supplements. Okay, unless you're keto adapted, it's not going to work that well. I think if someone, if someone is well trained and potentially then taking extra ketones, could it help them athletically? Maybe. Okay. But keto supplements, it's like the sense in it just doesn't make a whole lot of sense to me. It won't make you keto adapted. It may, you'd have to take a whole lot to actually raise your ketone level in your bloodstream. Because first, if you're taking ketones as a supplement, it's going to pass into your intestinal tract. The intestine's going to, it's basically going to break down a lot of these ketones there, and subsequently digest them and use the breakdown products and whatever else it needs, what else your body needs to do. It'll utilize some of those things. So can it actually raise the ketone levels in your body? Does that actually make you more fit? It's like, well, I don't know that that changes anything unless you've actually decreased your carbohydrate amount significantly. I can't claim to be an expert on that topic, but it seems to me that it's a waste of money. Certainly, I don't think it's going to hurt you. Okay. And then there are other things, there are things when we talk about weight loss, like raspberry ketones a number of years ago. We're like, oh, raspberry ketones can help you lose weight. Okay, it's a different type of ketone. And so it's not like the energy producing ketones. It's a different type of ketone in there. So likely there are all kinds of different ketones. And so subsequently then in your body breaks down kind of beta hydroxybutyric acid. That's the kind of what we typically utilize for the energy source. Okay. All right, let's see. So again, if you think more things, let us know. Very good. Well, little reminder, stop by, you can get your body count done still. Okay, log into the membership portal is the most important things. Get your weight loss tips, should you get the weekly recipes. All the other educational materials are in there. Tune in each Tuesday, 12:15 for our next webinar. Watch your email for the invite and link. And remember, it's your life. Make it a healthy one. Have a good day, everyone.